Good afternoon, ladies and gentlemen. Let's welcome Dr. Jamil to our show, Lifestyle with Dr. Moby. I'm Dr. Moby, and today we're going to talk about winter blues or winter problems. Let's welcome Dr. Jamil.
Hello. Thank you for inviting me. And I'm Dr. Jamil Ahmed. I'm a internist and also a geriatrician. So winter is coming. It means that fall is already on the way, and the color in the leaf has changed. The mosaic of color is unforgettable. But at the same time, we know what comes next. The temperature will start to dip down, and the colorful leaves will leave us soon. And the cold temperature brings some specific issues that we deal every year and unavoidable, but we have to know what's expected and we have to deal with it. Like all animal, in winter, our temperature also dips slightly. It's a part of our evolution, and when the temperature drops a little bit, there's some correlation with our immune system. So people tend to get more diseases. Some diseases are more common in winter and expected. Give an example. In a cold weather, we all get sore throat. It can be viral, like you call strep throat. It can be the dry, cold air, and sometimes allergies, which is very common. If it's not infection, just gargling with a salt water, it will be enough. But if you have an infection like a strep throat, you will need an antibiotic, and probably you need to see a doctor to make sure that you have a strep throat, because we don't want to use antibiotic unnecessarily to treating every sore throat which is not infection. Bad thing that happens at that time is a pneumonia, which can start as a viral infection. Then it can turn into a bacterial pneumonia, which is serious with a high fever, chills, and sometimes confusion in the older people. So we see that it is not uncommon that will come with a shortness of breath, like you with a COVID infection, COVID-19, and the people will get a pneumonia from it after virus infection is gone, probably. So it is a problem that you have to deal. And if you have pneumonia, you better see a doctor, because you will need some good antibiotic to control it, and also give some breathing treatment to help you to breathe better, because your oxygen may drop. Usually cold will not make your oxygen drop, but infection sometimes can. And the common thing that we see is a ear infection, earache. It happens with a clogging of the eustachian tube. There's a tube between the ear and the mouth that keeps our middle ear open. Sometimes that can get clogged, and that can cause infection. And in older people, that's the risk factor. And also smoking. If you're a smoker, probably should not be smoking anyway, but it will put you to a higher risk for middle ear infection. And if you have a chronic infection like that, you will have some hearing loss that you don't want to lose, because you need hearing, because it is more important than vision. Next thing is asthma. It runs in the family, first of all, and you will know that you have an asthma. In the cold air, it will trigger your asthma. Sometimes you need to have a inhaler with the albuterol, which is useful at the time of asthma. And sometimes you need little different, like a steroid, whatever it takes to control the asthma. You'll be surprised to know that in cold weather, you get heart attack. Do you have any question, Dr. Moby?
Yeah. I think I was going to ask you about for allergies. So we want to educate them, about allergies. There could be indoor versus outdoor. That's true in allergies, in summer and fall, or especially in summer, actually, the pollen count could be high.
That's right.
But uh, indoor allergens are not dependent on that. So there could be to indoor dust and mites or anything. So those can still be prevalent, although luckily they go down as compared to, and like you said, it can cause runny nose, ear infection, and it can cause sinusitis and
Yes,
chronic infection.
that's right.
So those are important. Also, tell us about some of the with other winter problem with the mood disorders which we see.
Okay. As I was trying to tell, is that if you have a coronary artery disease, cold air is not good because cold air make you use more energy to function. And anytime you make your heart more, you put a strain on your heart. So you have to be careful that you bundle up yourself very well if you have a heart disease. Otherwise, it can cause a heart attack, and which is very easily avoidable. Sometimes we see that older people, which is not, well, which they're not usually very physically active, all of a sudden they want to go out and clean the snow, which is good, but at the same time, it can strain your heart and cause some problem like heart attack. So it is better that you know your limitations. And the way you know that you have a heart attack is that you'll have a chest pain, obviously, you get short of breath. Sometimes chest pain will go to your left arm or to the neck or to the jaw, and you have shortness of breath. Some people have nausea and headache. So, or lightheadedness or dizziness. So if you may have arrhythmias, so you have to make sure that you know what you're dealing with when you go out in the cold weather. And family should be aware of that too. Joint pain is common in cold weather, and we all know who has issue with arthritis that it always gets worse in the winter. Another thing that we always talk about is dry skin. With a low humidity and cold weather, everything together, people will complain of dry skin a lot. The way they tell is that I itch all over. And the treatment is essentially moisturizing lotion and drink plenty of water. So make sure that you don't get dehydrated. And another major issue that we get, we call seasonal affective disorder. I will go back to that, and I will ask Dr. Mobi whether he has any questions.
I think those are important concepts which you have outlined, especially about a heart disease, because I used to be in Midwest and we used to see a big increase in MIs during winters because people would try to first shovel the snow, not realizing their capabilities. So all their season, they never actually did any exertion or anything workout, and all of a sudden they want to shovel the ice or snow, and that's a lot of workout. So they kind of underestimate their stamina, and they could, guess what, have a heart attack. The other problem we used to see was they would go for deer hunting or something and then try to lift those, and all of a sudden, and not to mention pneumonia. So the cold air, very cold air, is also irritant to the airway, and it can overwhelm, especially if you're drinking alcohol and outdoors. You might feel warm in the skin, but your lungs not capable of handling that cold air. As a result, they will develop pneumonia. So those MIs, pneumonias, we used to see big number when we were on call, and that's always a problem, with winter. So unfortunately, people drink and then they try to beat the cold by going outside. I don't know the logic why they do that, but they tend to underestimate or overestimate their immune system underestimate and overestimate their body to capability, and those are pretty scary thoughts. MI is a big one. So we used to see that. Also, if you can also tell us about seasonal affective disorder, because that was a big one, which also actually now we're seeing because of indoor. Okay, we are back, Dr. Jamil. Let's catch up with the seasonal affective disorder.
Well, as I was trying to talk about the seasonal affective disorder, this time of the year, people start complaining that they feel depressed, they don't have energy, they have trouble sleeping, they feel hopeless, and have trouble concentrating on things that they did easily before. In some extreme case, they even thought about killing themselves. So this suicidal thought. So it is not a simple thing. It is not. It's a difficult thing for a lot of people. We call it winter depression. And during this time, some people will oversleep. Some people will be loss of appetite, and some people will be eating more and start to gain weight. Similar thing can actually happen in spring and summer, and we call it summer onset affective disorder. Complaints are the same, but the number of people who have this summertime depression is much less compared to the winter time. So we always talk about winter more than summer issues. Complaints are the same. It's like we are getting too much weight, losing too much, gaining too much weight, can sleep, anxiety, agitation, having difficulty with family. So to find out why it happens, we all have a biological clock in our system. It changes with the sunlight, triggers our body to do a lot of things that we even don't know. And there is a chemical called serotonin. The serotonin is in our brain that communicates with other systems in our body. We call them neurotransmitters. That time of the year, they found that our serotonin level tends to go down. So we use a lot of medication to bump up the serotonin. Another thing is called melatonin system that we think of sleep. That's also get changed and subdued. So it is kind of difficult thing for a lot of people because, all of a sudden, they don't know what's happening to their body. It is happening inside their body. If you think that who gets the SAD, strangely, that almost 10% people who has a SAD has a diagnosis of bipolar disorder. So it is a psychiatric illness, and people who has a seasonal affective disorder tend to have bipolar disorder, depression that they may not know. Who gets it? Like a female, they get more than man, usually young adult, and they have family history like anything else. And the depression and bipolar disorder, as I told you already. And further you live away from equator, there seems to be more issue with this seasonal affective disorder. Why we should look into this thing and why it's important? Because there tends to be a lot of alcoholic in this group. They also have ADHD, bulimia, anxiety, panic disorder, or personality disorder. So it is a mixed bag of psychiatric illness, and that stays with a seasonal affective disorder. Sometimes we do not treat them because we don't know them. So if somebody has a seasonal affective disorder, probably should, or we should, look into underlying reasons whether they need to be treated more seriously. If you have multiple comorbidity, they tend to get more. And understandable, probably their health is not good, they're not feeling well, on the top of the inside the body and the brain is going haywire. So if you get a seasonal affective disorder, how long we should be expecting to last? 40% of the times is a year. So in a year, or 40% of the time it will last. So it's a long time, not 1 day or 2 days. And 70% of the times it will return next year. So not everybody will get it next year, but it can come back, jump a year or two and come back again. Only 15% of people will get better completely. So as I tried to illustrate before that, when you see a seasonal affective disorder, it's just not a single entity. It is a part of depression, bipolar disorder, and things like that. There's two types of bipolar disorder. One is type 1 and the type 2. If you have a manic phase, you call type 1. And treatment is essentially the same, like you treat them with an antidepressant, your psychotherapy, and light therapy. It's very important that we maintain a sleep cycle. Make sure that you sleep on time, get up on time, you exercise 4 hours before the sleep, and you try to avoid caffeine, alcohol, or smoking. And don't go to bed hungry, because we don't want to get up early in the morning and because you're hungry, and some relation with hunger and hypoglycemia, not feeling well, is there. And try to take measures to get some worry off your head. Sometimes you write it down so that you can think about it tomorrow, so you don't go to bed with thinking about things that you cannot solve that night. Exercise is very important. You exercise every day. Even if it's a cloudy day, you still do it, because you have to maintain a system or a organization in your life, day and night cycle. And also, what kind of exercise? Lifting is not that type of exercise will help you. It will be aerobic exercise, walking, that type of exercise. And make sure that there's a lot of lights in the house. Dark house is not good. And also, they call dawn stimulation. Dawn stimulation is that, suppose you wake up at 6 o'clock or 6:30. Half an hour before, you turn your light on slowly, so that body can sense, your eye can sense that there is some lighting going on. So that will also help this maintain a cycle in your body that tends to break down in this SAD or seasonal affective disorder. And the medication that we use, as I told you, that it is an antidepressant. Most commonly, they call SSRI, which is the most common medicine used nowadays, and like Prozac, Paxil. So those are probably commonly used. Sometimes, if you cannot take this type of medication, SSRI, you can take bupropion or Wellbutrin, which works probably as good. One good thing about Wellbutrin is that if you try to quit smoking, probably it will help you to quit smoking. You have any question, Dr. Mobi?
Yeah, I have a question about these seasonal affective disorder. You think that phototherapy would help?
Yes. Phototherapy is excellent. Actually, it's one of the things that has no side effect. How much light I will need? It'll be 10,000 lux, LUX. Lux is a Latin word, means light. So if you are in a city if you're like a prescription, I have to give you a prescription. So you have to sit in front of a light box, approximately 16 to 30 inches away, and then stay there for 30 minutes a day. You really don't have to look at your light directly. You can sit down in a room and read your books, work in a computer. As long as there's a bright light in the room, it is good enough. If you compare with in a sunny day, how much light that will be, it will be almost 100,000 lux or 125,000 lux. It's a pretty bright light. You don't need that much of light to break the cycle. So like a light here in the room is probably 250 lux. So you need pretty intense light to have the good phototherapy. Yes.
So also important is, some of the eye problems because of the dryness. You might get dry eyes a lot, and that's another thing is for these can actually make skin problem worse too. So skin and dry eyes, I see a lot of patients complain with winter. So those are the other things which anyone should be looking for. So let's, for the time's sake, let's wrap up for our audience and see if we can get a final words for audience.
Well, you have to be healthy in this winter. As we all practicing hand washing, it will help to stop the spread of the disease, all kind of disease, virus especially. And cover your mouth when you sneeze, drink a lot of water, and take a lot of rest, because rest gives your body some immune system. If you're overworked, not having sleep, it's not good for your health. And when you're going out, make sure you bundle up, because sudden change of temperature is not good. We're not used to being in a change of temperature that fast. And if you live in an area which has a low sunlight, please have some vitamin D, which is good for you different ways. It's good for your bone and also good for your mind. So if you're good for the infection, immune system, and we are talking about this a lot in our recent COVID virus pandemic. Phototherapy is a good option and it's a safe option. So it should be tried along with psychotherapy, medication, and everything. If you do all things together, your response is much, much better compared to doing one at a time. In that sense, at the end, I can tell you one thing. It's a Japanese thing to say. One kind word warms 3 winter months. It means that we always should be nice to each other, and that will make our life easier for everyday life. Thank you.
Well, thank you for coming, and it was a great learning experience. And thank you for watching our show. Give us feedback, send us Twitter message or Facebook, whatever you like. And thank you for watching our show. Thank you, Dr. Jamil, for coming on, and take care.
Thank you.